I am honored to receive this gold award at the third academic paper contest in ASIA Congress. My name is Hideki Ueyama from Osaka, Japan. I would like to talk about my award paper in Paper Express session. The title of my paper is Long-Term Clinical Result of Alumina Ceramic Medial Pot Total Knee Arthroplasty, a 10-year follow-up study. This slide demonstrates the citation for this paper. Many models of TKA implants have been reported good long-term survivorship. However, these reports are mostly for metal implants. For example, the title published in 2019 at The Lancet, the very big journal, which summarized the long-term survivorship of many implants, were about almost all metal implants. However, metals are not the only biomaterials. Ceramics are another familiar biomaterial in the medical field. For example, orthopedics and dental fields. So, what is the advantage of ceramic? They can be summarized as follows. Briefly, ceramic have high wear resistance. In other words, it has a smooth surface, and hardness and lightweight. The wear resistance is the most important characteristic. If the articular surface is smooth, and there is less friction between the polyethylene insert and the femoral component, there will be smaller number of wear particles from the polyethylene insert. The reduction in wear particles is expected to prevent septic loosening. In short, the ceramic material is expected to lead to long-term survivorship. By the way, what is the advantage of medial pivot design? The medial pivot design is characterized by the ball and socket shape of the medial compartment, and this design provides a very high conformity. It is also expected to be useful for long-term survivorship by reducing polyethylene wear particles. For these reasons, ceramic medial pivot design TKA was expected to have long-term survivorship. However, the actual survival rate was unknown in previous reports. The aim of this study was to investigate the current model of ceramic medial pivot TKA, Physio knee system, in 10-year follow-up study. The design of this study is a retrospective cohort study. Patients were enrolled into this study who underwent TKA with physio knee at our hospital between 2007 and 2011. Patients who dropped out were excluded, and 10-year follow-up 96 patients were analyzed finally. Clinical and radiological outcomes are evaluated at the last follow-up visiting. Conservative surgical techniques are used. Briefly, surgeons approached the bare medial patella and PCL were resected. Then, resecting femur and tibial referencing anatomical landmarks. The target alignment was perpendicular to the mechanical axis. Patella was resurfaced in all cases. All components were fixed by bone cement. The primary outcome of this study is survivorship of TKA implant. The survivorship was evaluated by Kaplan-Meier curve having two different endpoints. One is all reoperations. Another is all revisions. Secondary outcomes included clinical and radiological parameters. The definition of the word reoperation means all surgical procedures after primary TKA. For example, the only insert exchange or debridement and irrigation included this category. The definition of the word revision means the removal of femoral or tibial components. Of course, both components exchanges included revision surgery. Patient demographics of 96 patients are shown in this table. The mean age was 70 years, female was 94%, average BMI was 27, and all patients had various deformity of the knee osteoarthritis. The average follow-up period was 11.8 years, with an, of course, minimum follow-up of 10 years. The clinical and radiological outcomes are shown in these tables. Almost all clinical outcomes were significantly improved with TKA. Radiolucent lines were detected in 28%, and aseptic loosening was observed in 3% of patients. The survivorship of TKA is shown in this slide. The Kaplan-Meier curve on the left, with all reoperations as endpoints, shows that 94.8% at 10 years. The right Kaplan-Meier curve with revision as endpoint shows the 95.8% survival rate at 10 years. Details of revisions are shown in this table. The most common reason of revision was aseptic loosening. There were no serious implant breakage, such as ceramic fracture or other serious complications due to implant materials. Risk factors associated with aseptic loosening are analyzed in detail. No specific risk factors for aseptic loosening were detected in this implant. The main finding of this study was that the revision rate of ceramic medial TKA was 4.2% in 10-year follow-up. The other models' revision rate were summarized from the AOA registry data on this table. The average revision rate for the other many models are 5.7%. So, the ceramic medial TKA has a relatively good survival rate. However, aseptic loosening was the main reason of this revision in this implant. This is similar to other models. In theory, this implant made with ceramic is considered to have a smooth articular surface and the ability to reduce wear particles in vivo. Unfortunately, however, it seemed to be difficult for even ceramic TKA implant to eliminate aseptic loosening. The design of a femoral component is changed in the current model from the previous one. The past study reported that Asians had relatively longer femoral AP lengths in small-sized femur. The design of the current model has been modified to conform such anatomical morphology of Asians. So, this TKA implant design is very useful, especially for Asians. Ceramic implants are also useful for patients with metal allergies. Metal allergies are most frequently seen with nickel. However, it can also be seen with cobalt, chromium, and even other metals. Ceramic is, of course, not metal, so it is very useful for these patients and can prevent metal allergies. Conclusions of this study: the current model ceramic medial TKA has a 10-year survival rate of 95.8%. This survival rate is one of good results among current models in the world, and this design conforms to Asian anatomical morphology. This ceramic TKA is also a good choice for patients with metal allergies. We will provide a QR code to the article on this study. Scanning this code will take you to the journal website, where you can obtain the article in free. Thank you very much for your kind attention. Thank you.